Peruana, Cayetano, Heredia.
Cayetano.
About to hear. Delighted that everybody could get here this evening. I'm Anne Johnson. I'm the Vice President International of the Academy of Medical Sciences. And you know, tonight we have one of our premium lectures in our lecture series this year. The Academy is, of course, the National Academy for Medical Sciences, and we're very proud to have a very broad representation of people across the medical and health sciences and its translation into, and to look at how we can promote medical science and translate its benefits into society. And the International Health Lecture in particular is a real platform for us to hear from leaders in global health, to talk about topics of real international significance and to promote discussion. And I think tonight's subject on corruption in health research and health is one that is absolutely one that will promote, will, I'm sure, provoke a great deal of debate and discussion. The International Health Lecture has now been going for 15 years, and we're absolutely delighted that this is the 4th year that we've been able to partner with the Lancet in what is the Academy of Medical Sciences and the Lancet International Health Lecture. So I really want to thank the Lancet and Richard Horton in particular for partnering with us in hosting this lecture. Now, this lecture is being live streamed, and the video of the lecture will be available on the website after the event. But what's really exciting this year is that while we are here in London, the lecture will be live streamed to the British Embassy in Peru, bringing together researchers across the world and researchers who are active in the country, in that country, to watch and to interact with us. And I hope they will also, like you, will be participating in the debate using Twitter, and the hashtag, I hope, is up there, but if you can't see it, it's IHL 2019. And we hope you will use that hashtag, but please do keep your mobile phones on silent during the session. So we've got a very exciting programme this evening. I'm going to be passing over shortly to Richard Horton to introduce this evening's speaker. But we'll be hearing from our lecturer, Patty García, for about 50 minutes. We'll then have an opportunity for what I know will be a very lively Q&A, because when Richard Horton's in the chair, you can be absolutely certain that we'll have the best participation and plenty of provocative discussion. And after that, we will revive you all with drinks and canapés outside. And the last thing that I have to tell you is that there is no fire alarm planned. So should there be one, you must leave, but there is no fire alarm expected. So with no further ado, I would like to pass over to Richard Horton to introduce our speaker for this evening and to introduce the lecture.
Great.
Richard.
Thank you very much. Well, welcome to everybody here and to our colleagues and friends in Peru. The lecture you're going to hear this evening will be published online tonight on the Lancet's website. Freely accessible, I should say. Here it is. I have the only known copy in my hands, and you're now going to hear what a fantastic lecture this is. Patty García, MD, MPH, PhD, is a professor and former dean of the School of Public Health and Administration at this university, Universidad Cayetano Heredia in Lima, Peru. It's a position that she's held since 2011, except for a very important, indeed life-changing period of 15 months when she was Peru's Minister of Health. She's a former Fogarty trainee and the very first woman to lead the Peruvian National Institute of Health. Patty graduated from medical school in Peru, and she trained in internal medicine, infectious diseases and public health at the University of Washington. She's worked in the Peruvian National STD AIDS program. She's been Director of Epidemiology at the STD-HIV unit at her university and Vice Dean of Research at her university. She's been a member of the Senior Technical Advisory Group of the Reproductive Health Department of WHO and Chair of WHO's HPV Expert Advisory Group. She's been a member of the Pan American Health Organization's Foundation Technical Advisory Group and a board member of a whole host of other organizations. She's been appointed a member of the United States National Academy of Medicine, becoming the very first Peruvian professional with such a distinction. Her wide and stellar leadership and experience in national and global health makes her the ideal candidate to talk about her subject tonight, corruption in global health. Please give Patty García a very warm welcome this evening.
Thank you so much. Good evening, everybody. And I would like to start by thanking the organizers for the honor and the opportunity of presenting this year's International Health Lecture. Thank you very much to the Academy of Medical Sciences and to Professor Dam and Johnson for the invitation, and because she convinced me to come, really. And also to Professor Richard Horton for his kind and generous words. And thank you all for being here tonight to listen to this very unusual talk within academics. You know, I think we usually try to get together to talk or maybe to theorize about several things, or to talk about positive results of studies. But sometimes it's important to talk also about the crude reality. Talking about what is not going well can catalyze the process of changing things. And this is what I am going to be talking about today. So, let's see here. So probably all of us have heard about the extraordinary time that we are living in the history of public health. Each day we have more technology to fight diseases and to improve lives. We're continuously doing numerous randomized, sophisticated randomized controlled trials and to test whether a medication or an intervention drugs or works. This is indeed a key moment in history. However, all these incredible breakthroughs will mean very little if they do not work in real life and if we cannot reach all people. And that's why right now also we're starting to talk about careful planning, implementation research, the need of having commitment, leadership in order to make things work in health systems. But you know what? What we are not talking about is about the main challenge that we are facing in global health. Yeah, we don't try to say that word, the C word, corruption. And I want to make a stop here because I'm going to be talking about corruption in global health. And I want you to know that I will be using the term global health to refer to the health of populations in the whole context, and not to refer, as many do, wrongly, I really think wrongly, to investments of organizations, foundations, or high-income countries to try to address health and the development challenges in those countries that has less resources, or countries in the South. So the reality is that corruption in global health is an open secret. Everybody knows about it, but nobody wants to talk about it. And so I decided to take this opportunity to reach and talk about this word, as scary as it is, as dark as it looks, as big as it is, because we need, I can see that we need as researchers and academicians to find out how can we contribute by developing and testing models to fight corruption in global health, and also to pledge to funders, so to ask them, how can they really support this effort? So the task to work against corruption is an urgent task. Corruption is the biggest threat for the future in global health. And I have to say also that my main disclosure is that I am not at all an expert in the topic, except that coming from a low middle income country, I had to live all my life surrounded by corruption, which actually has been seen as the normal status, or even as a coping mechanism. And there is another thing that I have heard from a lot of people, a cultural issue, which I hate. And the other thing that I heard, it's like, well, you know, it's survival corruption. Survival corruption because you have inadequate pays. And all of those things are basically unacceptable. As a medical student, I saw things happening around myself with practitioners, with medications, with supplies. But since 30 years ago, when I was a medical student, since the system was really poor, there was not too much to steal. However, when I became Minister of Health, although I was very happy, and you can see it there, because I was going to have the opportunity to really serve my country, I soon realized the huge magnitude of the problem, especially because there were more resources, and with more money, there is more corruption. And for those that don't read Spanish, what it says there is nightmare corruption, and you can see my face. So, yes, with more money, there is more corruption, okay? And the availability of foreign aids for health have also fueled corruption globally. And this is something that nobody can deny. I have seen how, in order to move a strategy on or to complete an implementation, it was viewed as acceptable, although sometimes odd, in the words of the funders, to pay extra for activities that are part of the provider's job, or to simply overlook things that were uncomfortable. One example that has been happening a lot is paying health care providers to attend training sessions. Isn't training part of their job and also an incentive? Well, it used to be in my country, okay? But for several global health programs, paying health workers to attend training sessions, that became a practice and created an unsustainable vicious circle. So what happened is that at the end, the health workers that were participating in the trainings were not the ones that needed the training, but the ones that were selected to receive the incentive, and sometimes even self-selected. So, and that is the reality now globally. With more resources, the whole world is erupting in corruption. So what you can see there in that map is that 2/3 of the world are perceived corrupt or endemically corrupt. And that comes from the Corruption Perception Index 2018 from Transparency International. And millions of people around the world are really tired of that and are protesting against it every day. And when we talk with the honest health workers, they are suffering from burnout, not because they had to work a lot, but because of the frustration of not being able to fight against corruption in the health sector. Some of them decide to go into the dark side. Some of them decide just to leave and don't work in the public sector. So corruption has a disproportionate impact on the poor and the most vulnerable, increasing the costs and reducing the access to social services. One of those social services is health, and corruption is really deadly. Corruption is abuse and violates the rights of individuals and communities. And when corruption relates to health, it really affects health systems, individuals, and health outcomes. And it really deeply affected them. To talk about some numbers, you know that there is an estimation that each year corruption takes the lives of at least 140,000 children. And probably we are not counting all of them. It worsens antimicrobial resistance, and it undermines the efforts, all the efforts, and all the funding that is going into controlling communicable and non-communicable diseases. And we're not talking about it when corruption is the worst pandemic, because it is the ignored pandemic. So somebody was asking me, what is the best definition of corruption? And actually, there is no one comprehensive and universally agreed definition. Probably we can use one that can tell you everything. Although when people see corruption, they can tell you that's corrupted, okay? So it's the abuse or misuse of power or trust for personal benefits. But how did corruption started and spread? Well, corruption has existed for a long time, probably as long as there had been social structures. Some suggest that in the development of social structures, there are clear differences between what happened with nations in the north compared with the nations in the south, which could explain why in the south we have a high endemicity and higher amounts of corruption in comparison. So governments in the north were created to serve the populations and the nations, while the colonies were structured to really exploit countries. Later on, when the colonized nations became independent, the social structures were maintained these colonial practices and continued to benefit the new individuals that were in power. However, really corruption has become endemic in the last 30 to 40 years, and that's when we started talking about eruption of corruption. And probably that has been associated to the profound changes during or after the World War II and also with the Cold War, when the whole world changed, turned around, and we started seeing even new countries with weak institutions that were vulnerable to abuse or misuse, with authoritarian regimes, and also in this big change in the world, business people from North America and Europe were looking for new markets, and in order to speed things, because these weak institutions were not working well, they started greasing the wheels for corruption. And this practice spread. So that's, some people call it the virus theory. But why is it important to talk about this? It is important because in our global world, so we all together, we have to recognize, number one, that there is a role in the developed world as the supply side of the corruption equation. And I'm mentioning this because sometimes when people talk about corruption, it's like, oh, it is in the South. And actually, we're talking about the global problem, okay? The second thing is that in order to have corruption, we need to have corruptors and corrupted. And when I say this, I want to go into the positive side also. That means that we need to work together, the North and the South, in the quest for a solution for this global problem. So we're talking about corruption, but let's go directly now into corruption in health. So health is, unfortunately, a very attractive sector for corruption. Why? Because there are multiple parties involved, because there is a lack of good record keeping, and there is a complexity also on distinguishing among corruption. Although I told you that people can distinguish, the good people sometimes feel that maybe this is just inefficiency or honest mistakes, and that could happen. Corruption in health threatens any effort that we could do to reform the public sector. And also, it threatens any effort to reach universal health coverage and to achieve the UN Sustainable Development Goals. And corruption, as I said before, causes the motivation and burnout of human resources. And human resources are the key of any health system. And as some people call it, it is the cancer of our health systems. And how much does it cost? Okay, every year the world spends more than 7 trillion US dollars in health services, most of which is financed by taxpayers. And there's some estimations that calculate that at least 25% of that money, that global expenditure, is lost through corruption. If we make numbers, that means that the society is losing billions of dollars. And it happens that WHO and the World Bank, independently, they have been doing estimations on how much it will cost to have universal health coverage for the world. And so it seems that if we don't lose that money in corruption, we will be able to do the unthinkable, to have universal health coverage. So we really need to fight corruption. And there is one more thing. What we're not talking is about the human side. So we talk about the numbers, we talk about the systems. But the true cost of corruption for people, it's really impossible to calculate. It can mean the difference between wellness and illness, between life and death. So there is corruption in health, and it's embedded and systemic in the health sector. But why is that? So Klithart and colleagues highlighted that the amount of corruption in general in a sector can be really presented in this very easy equation. So the amount of corruption relates to the M, which is the monopoly of the supply of a good or a service. D, that is the discretion enjoyed by the suppliers, minus the accountability. So there is going to be more corruption if there is more monopoly and more discretion and less accountability. And guess what? That sounds like the health sector, doesn't it? So, and this is something that we are seeing. Unfortunately, those are the characteristics of health systems. And even more, the health sector has lots of complexities within the system. And I said multiple actors that participate and increase the susceptibility to corruption in the sector. There are at least 5 actors in the health sector that are quite important. The government, that usually is the regulator, the payer, the suppliers, on one side, for example, construction, or suppliers for drug and equipment, the providers, that could be public or private, and the patients. And between all of them, we have a mixture of interactions. And unfortunately, in all those interactions, we can see different ways or different types of corruption. And corruption can go from petty corruption to high-level national or even multinational corruption. And in those different points of the system, we can see it at the service delivery, at the purchase, distribution, delivery of equipment, drugs and supplies, on the regulatory side, on the hiring of human resources, on the construction. But one of the things that is quite important is what we see at the level of the service delivery. And this is what we see so often, and sometimes we ignore. Absenteeism that can be as high as 50% from some data that Transparency International has. Informal payments that are usually the ones that are much, much easier to recognize, bribes. But some people consider that that's normal, so they don't even report it. Embezzlement and theft of money, supplies and medications. Over or under service provision. One example of these are cesarean sections. The number of cesarean sections that we have in Latin America, and I think it happens also in the US, it's incredibly high, okay? And the reason why there are so many cesarean sections is because that gives a lot of money, okay? In India, they are seeing an epidemic of hysterectomies, okay? And those kind of things are ways in which corruption presents. Favoritism and manipulation of data. And manipulation of data usually is related with reporting things that had not been done and asking for billing, right? But I have to tell you that we see other things. In Mexico, for example, they were reporting manipulation of data, showing coverage of certain public health actions that didn't happen, okay? For example, vaccination. And of course, that means that without having good data, we cannot do a very good job in public health. We had the experience in working in maternal syphilis. We were asking the providers why we were seeing all these numbers. And actually they said, honestly, they wanted to be honest with us and say like, well, we're reporting more cases because if we don't, we will not get enough supplies. We will not get the incentives. And without the incentives, you know, what can we do? And people can feel that we are lazy. But that is part of what is happening as another way of corruption in our services. So, from my personal point of view, individual acts of corruption at the level of the day-to-day interaction of patients with health services and providers can look really small in scale, but they represent millions and millions of negative interactions and have an enormous and damaging effect on our efforts to improve health, and are also more difficult to address. In addition to this, those acts become normalized in society and are considered just the way things work. And unfortunately, and this is what you can see in one of the health centers in Peru with these long queues, it is so common to see these day-to-day forms of corruption which deeply affect our health services. For example, absenteeism. There is no doctor, so people had to wait in queues. Or the delay or the denial of supplies or medicines, which are sucked from the public sector to feed the private sector. Or the collusion of a hospital staff and an external pharmacy or external providers. So they don't offer what is supposed to be offered within the hospital for the people who had insurance. So people had to pay out of their pockets. Or doctors referring patients to their private practice, or health workers intentionally damaging equipment. And this is something that I have seen it as a minister, an X-ray machine with a paper clip. So it doesn't work. So people had to go, because they need an X-ray machine, to pay it out of their pocket to the X-ray center, which is right across the hospital. And if you ever go to Peru, you're gonna go and visit Machu Picchu and other places, but just go and see one of our hospitals or big centers. And you will see that it is surrounded by services, laboratories, lots of pharmacies, and lots of diagnostic centers, which shouldn't be there. So, and the worst part is that several times these centers are also owned or staffed by the same public providers or their close friends or their close relatives. During my time as a minister, I have seen all. Payments for free procedures and services, outsourcing, so services of the paid to the private sector that were completely deregulated, sales of jobs, overpriced purchase and constructions, medicines that disappeared, permissive rules against corruption, and lack of channels and attention to allegations of corruption. But one of the things that really shocked us is that we had to handle and overcome the uncovering of fraud in the National Comprehensive Health Insurance Program, which is for the poor in the country, by an individual who was the presidential advisor who tried to use his influence for lucrative contracts. And actually, there were some audio recordings that came and that were made public about a scheme to steer patients covered by this insurance into private clinics that were owned by his friend. And so this guy would receive commissions for each insured patient seen. And so as part of the recordings, he was saying, it is our big business. I have the people to do it. I have also the patients. Or you will see how much money we will gain. I was very lucky because when in the recording they asked about the Minister of Health, so me, he said, oh, he's a crazy woman. So yeah, and when the journalists were asking me, what do you think about what he said? I said, like, I think he's right. I'm crazy for public health, and I will keep working on that. And the difficult thing was that this guy was a friend of very important people, all the politicians, even a friend of the evil, right? And so we really had to deal with the situation. This situation confronts us, and this is the Prime Minister, and this is, on the side is me. Look at my face, okay? So we had to confront the fragility of the system, but we were really shocked. And actually, this is how we look in the newspaper. And that's what happened with corruption, right? And although it wasn't a scandal, okay, it took us a lot to really fight against this, okay? Finally, this happened in September 2016, and it took us almost 6 months to be able to fire him from the system, from the Ministry of Health system. We also work with the, well, we also started this civil process, but actually, eventually, after 2 years, we asked for $1 million compensation to the Ministry of Health because of what he did. And actually, the rule of the civil court was to pay 80,000 soles, but actually he never paid. The Peruvian College of Physicians took more than 2 years to finally rule that his medical license will be removed for only 1 year. And so far, in 2019, so I'm talking about 2016 to 2019, the anti-corruption prosecution requested 5 years of prison, but he's not in prison. I mean, he's still going on with all these processes. So, but we used the opportunity to establish a system to report incidents of corruption and investigate allegations of corruption efficiently. And we got some interesting results. I was Minister of Health 2 years ago, and I lasted 14 months, and I doubled the average time of a Minister of Health in Peru. So in these past 2 years, there have been 5 Ministers of Health, okay? So it's difficult to do things in such a short time. During that time, we had 522 allegations. We have 161 sanctions. We have 32 people fired. We have 13 people accused of crimes against public administration. And we really managed to have all these things and investigations in about 16 days. The system was supposed to continue, okay? But so far, with all the changes, we don't know. And there were other things that we were doing to fight corruption in Peru, but I didn't feel that I knew what was going on. So I decided to understand what was known about corruption and corruption control, because we had to do something. And I found some interesting things. So I found that there were at least 2 main groups of theories with respect to control of general corruption. So those that talk about the need of strong institutions and those that talk about the way people think. So the institutional theories are best described by the work of Transparency International. And actually, they introduced the concept of the national integrity system. So basically, this national integrity system is based on this holistic approach, okay, that you may have different institutions all working together, like dancing all together, fighting against corruption. And if the institutions are strong, then people would not even think about corruption. They will not even be tempted, okay? So, and you can find even this figure in Transparency International website. So you can see all the columns and all the things that constitute this national integrity system. And I have to tell you that in Peru we do have it, but still we have corruption. So the second theory has to do with the way people think. So basically, it talks about the way people process rule breaking or the decision of an individual person to engage into corruption. So I'm going to show you, I promise this will be the only additional equation that you have, because I showed you one before, right? So this is the equation. But I thought it was quite interesting, because in this equation, what we have, the first is the BP, is the perceived benefit of a corrupt act. So if the perceived benefit of the corrupt act is bigger than the sum of all the other factors, then the person will go and do the act of corruption, okay? So what are the other factors? So the first is the psychological costs. So this psychological cost had to do with how the person will feel to engage into corruption. So it has to do with personal values, okay? The second factor, or the 2 other factors, are the perceived probability of the criminal costs and the social costs, which had to do with social norms. And finally, the last C had to do with the cost of doing the favor or the corrupt act, which means how easy or how difficult it is. Okay? And in a way, it could be related also with issues of accountability. The interesting thing is that all experts agree that probably the two theories converge, because in order to assure social norms, we have to have strong institutions. And if we want to have strong institutions, we really need to have people that will follow the norms. So, well, it was quite interesting, and I kept reading, and I explored what else could be done to prevent corruption from happening. And what I found is that there was a lot of theory, but I wanted to see, and in this theory, I mean, there were lots of things that people talk about: enforcement, disclosure, incentives, salaries, voices, sanctions, etc. But what I wanted to know is what was the evidence behind these things. So I decided to look in PubMed. As an academician, as a researcher, that's what you will do, right? So you will go into PubMed, and I started exploring the term corruption, and I was shocked by the scarcity of publications. And so then I decided to compare it with the term breast implants. And this is what I found. So corruption and breast implants. And I said, well, let's try to look for something that I know about, because I work on STIs and HIV, etc. And oh my God, okay? So what you see, the orange ones are the little small one breast, and the blue ones, which are corruption, you cannot see it. So for 2018, to give you an example, I found only 122 articles related to corruption, compared with almost 500 articles for breast implant and 14,178 articles about HIV. So the conclusion is that very little study about corruption. The worst part was that most of the articles were related to a description of a case of corruption or an analysis of a problem, exploring cases, situations, and some of them were providing these specific recommendations, but all of them were based on theories. However, I found a couple of articles, one in 2012, and another one, which was a systematic review, and another one in 2016, which was a Cochrane Library systematic review. And you can read it if you want, but I want to make the story short. The conclusion is that there is an absence of evidence of what works to reduce corruption in the health sector. And that's where we are. We have no idea what can we do. And I mentioned that corruption should be seen as a disease. And if it is a disease, we need to know how can we prevent, how can we control, and eventually eliminate. But we don't have any data. So, in our transformational agenda in global health, we are all talking about different things. We talk about the need of strengthening health systems. We talk about the need of working with human resources. We're talking about the need of working on prevention and public health. We're talking about having modern and interconnected health infrastructure. And for all of those things, we need to invest, means money. But we are not going to be able to do anything against, we really include in this agenda the fight against corruption. But how can we fight if we don't know what works? And that's why we have to add. We have to do. We really need to discuss research on interventions to reduce corruption in the health sector. So this is me with my final reflections, okay? So I told you, societies are losing billions of dollars due to corruption, and this cannot continue. Health systems are immersed in corruption, and we really need to do something. It is our responsibility in global health to create the knowledge. Solutions against corruption in the health sector need to be sought. Even in the absence of a strong health systems or political will or systemic reforms, What we are lacking is the knowledge of what interventions work. We can start small and grow. Again, let's think how we do it with diseases. We need research and interventions that can reduce corruption in the health sector. You can choose this equation or the previous one with the monopoly, the discretion, and accountability. But we need to start thinking, what can we do? How should social norms be addressed? How can we work on accountability, transparency, maybe better information systems? Can we use the technology? Can we use electronic medical records for this? Can we really do it? How can our professional education programs be improved? One of the first things that we need to do is we need to start using the right word, corruption. Even WHO does not use it. They use governance. So everybody is scared and afraid of using the C word, but we have to say it. And I'm not going to ask you all, but I should ask you to say corruption altogether, because that will throw the fear out of you. We need to have the community involvement, the power of the people, but we don't know very well how to do it in public health yet. Okay? Some of our countries, we work with community involvement, and when the community gets involved, things work. So why don't we do that also with corruption? We have to improve the delivery of services. We have to create channels for allegations and sanctions. Yes, of course, we have to. But one of the things that we need to do is we need to learn how can we conduct research on corruption in ways that we can capture what is really happening. How can corruption in health be measured more accurately? If we don't measure, we are not going to make any changes. We need also funding to do research about corruption. And we need the two Bs, brave and brilliant researchers that could be interested. And here is my call. I call today for the elimination of corruption in global health and for the creation of a coalition of researchers, global people from all the world, okay, that would like to start working on this issue. All countries, irrespective of their level of economic development, should be equally committed to helping ensure that in our world, corruption in health will be eliminated in the same way that we achieve commitments for the elimination of diseases. We need to have effective anti-corruption models that could truly accelerate improvements in global health. For that, we need research. It's not just a matter of the government and the sanctions. We don't know what works, so we need to really understand. If we really aim to achieve the Sustainable Development Goals and to ensure healthy lives for all, corruption in global health must no longer be an open secret. And let me read this for you, because I was reading, and actually I really got shocked, but this is what is happening. We need to stop the normalization of what corruption is. And this is what it says. I'll tell you something my father told me when I was a young man. My son, he said, the greatest force in life in this country is not the government or the religion or the entrepreneurial instinct, is the bribery and corruption. And he said it like one word, like electromagnetism. Without bribery and corruption, nothing would happen. It is bribery and corruption that oils the wheels of the nation, and it is also the solution to our nation's problems. If there is terrorism, come on, sit down across the table with the terrorist boss and sign a blank check and push it across the table and say, put as many zeros as you like. Once he has pocketed the check, the problem is over, because in our country, we understand that there is honor in bribery and corruption. This comes from the Golden House, Salman Rushdie. But the reality is that we cannot keep the way we are in the world. We have to stop corruption in global health. We all deserve countries with no corruption. We all do. Thank you.
Thank you.
Thank you.
Brilliant and brave, that lecture. Congratulations, Patty, on gripping, I think, the audience completely from the very beginning to the end. I say brave, and I don't say that lightly, because speaking out like that on an issue that is so endemic, as you so well shown, is a courageous thing to do and can bring danger to you in many ways in your career. What has been the reaction for you talking about corruption, which so pervades the system as you've shown?
Well, I think the people that listen to me gets more scared than I do, really. Yeah, I mean, I know it's scary. I mean, I'm not asking you to confront the corruption and go and try to find all the people that are corrupted and follow them and try to sanction them, okay? As a minister, I mean, I have received threats, of course, and from not having any bodyguards at the beginning, because we're supposed to have bodyguards, and we said no, I end up having at least 2 to watch my house, okay? It's true, because those are the kind of things that happen. I used to say also when I was interviewed, like, well, you know, we have to talk about these things because these things had to stop. But if somebody finds my body in a corner with lots of flies or whatever, you will know that I was really going into what was corruption, right? Yeah, that's one of the issues why people don't talk about corruption, because people are scared, okay? But I think we have to break that fear. The same way we are breaking the fear of talking about sexual harassment or violence against women. Those are things that should not happen, so we need to talk about them. And I hope that you all will too. And when I'm talking about research, okay, it's not just to discover that there is corruption. What we should be doing research on is on finding what are the ways of preventing it. How can, I mean, and I want to give you a metaphor, okay? When there is a disease, right, and you are trying to find a vaccine, you start looking for the people that have been exposed and the ones that get the disease and those that don't, right? And then you try to find out what are the differences. I mean, it's the immune system, some are immune. I mean, what are the things that are making them different? And then maybe in that way you will start finding what's wrong. Okay, so, I mean, not all the people that are in the health system are corrupt. Some of them are, some of them are not. So what prevents people to enter corruption? What are the kind of things that we can do? Okay, those are the things that we need to start looking for. That's what I was talking also about. How can we train our health professionals for the future to make it different?
Patty, you talked very powerfully also about this idea of a research agenda for corruption. And although Jeremy Farrar couldn't be here this evening, I know that you have spent some time with him today, I think. Jeremy is director of the Wellcome Trust. He has a few pennies. Do you think the Wellcome Trust will be investing in research on corruption? Tell us what he said to you.
Yeah.
You're amongst friends here, and it's only being live streamed.
Yeah.
And I know he's
Across
watching.
the world.
I know
Yeah.
he's watching because he keeps tweeting
Yeah.
during the course of your lecture.
Well, I think he has a very good point, okay? So people also are scared about talking or funding or doing anything about corruption or funders, because they fear that governments may get a little upset or they may get a little upset. So what he was saying is like, probably the funding should come from a donor that is not that close to any government.
Just like the Wellcome Trust.
Just like the Wellcome Trust.
Right,
And
exactly.
I agreed, okay? And I think one of the things that we were discussing, and I think it's great, and Jeremy, if you're looking at me here, I'm with Richard. Richard, one of the things that we should have probably a commission
Absolutely.
on corruption in global health.
Absolutely. A
that
Lancet
could
commission
start,
on corruption.
And so we can start this coalition.
Funded by the Wellcome Trust.
Yeah, and we can start this coalition because I have been looking around the world. I mean, I have been traveling and talking with people. I mean, this is a lecture, right? But I have been talking about my frustrations. I have so many frustrations from the time that I was minister because I wanted to do so much, but it was so little time. But corruption was one of the things that didn't allow things to happen to, okay? And so I was talking about that frustration, and I know that there are people that have been doing some work, some people that are scared of starting the work because they feel that then all the doors in the country will be closed. So we need to find ways of doing that type of research. And I think several minds working together, I think we can do it. We can do it.
We can do it. You heard it here first. Now, we have, it's over to you now. We have two roving microphones. We have Johnny, stand up Johnny, and we have Medina. Where's Medina? Hang on, where's Medina?
In the back.
Right at the back, excellent. And also, we have Sevda, who's got her direct link to Peru. And as soon as we have questions or any interventions from Peru, she's going to wave at me. And I'm going to ask, do we have anything yet? We have one. Yes, we do. So we're going to have the comment directly from Peru to Patty.
So the question is, do you think research on corruption can and should be embedded in global health research, and if so, how? It's from Amy Riley Powell.
Yeah.
Okay, how?
Definitely. It has, I think we have to work on researching in corruption. How? I mean, I gave some examples. However, I don't think it's going to be that easy. So we need to start maybe, I mean, looking at those equations that I show you, right? So should we start working on accountability? There are some people that are working on information technologies. In Peru, for example, we're studying, one of the things that we started was the introduction of the electronic medical records, okay? So how can we use the electronic medical records, for example, to document absenteeism, right? And then we can link that to some type of system where it can be followed and we can have some type, it's for the Ministry of Finance, that is going to be quite important because they are always very concerned about production, okay? So, and production and funding, right? So that could be one way. So there are so many things that we need to start looking at, but definitely we need to start working on research in corruption in global health.
Okay, I'm going to take 2 or 3 questions from the audience. Yes, Andrew, first, and then there, and then there. And if you could just say who you are and where you're from.
Andrew Tompkins, Chief of Global Health at UCL. It was absolutely fantastic to hear your lecture and your passion. I've got a particular question that I wanted to ask you about your emphasis on undergraduate training. I'm on a working group that's looking at conflict of interest and corruption in global healthcare, and we've discovered that how little there is in terms of training and awareness of all healthcare workers. And I just wonder if you'd give us a bit of your insight from Peru and elsewhere. How much is it defined? How much is it a key part of the development of doctors and nurses and other healthcare workers?
Okay.
How have you changed it?
Keep an eye on that one. And then gentleman on the corner, yep.
Thanks so much for your lecture. It's very interesting and very worrying. I wanted to ask about some of the...
Could you just say who you are?
Yes, I beg your pardon. I'm from the PPI committee of the City and Hackney CCG. And I was concerned about some of the countries you had marked in red on your map and how the people there with NCDs cope. I've been fortunate enough to have insulin supplies readily available since I was diagnosed in 1950. But surely you can see that if insulin is directed to those countries and the morbidity rates increase because diabetics are not being cared for because they don't get the supplies, surely that would be a lead into some form of research, would it not?
Okay, I'm also going for gender equity. So please, further up there, keep your hand up.
Hello, my name's Madeline Davis. I'm from the Bureau of Investigative Journalism. Thank you so much for your enlightening lecture. How can I bring this to a wider audience? What do you think are the key things that I should be investigating? And do you have any advice for me for going about investigating this topic?
Okay, let's take those 3 questions first then. Andrew's, and then the question about insulin, and then journalism.
Yes, so the first question had to do with conflict of interest. I think we're doing very little, especially, I mean, for health providers and even less for the undergraduates. And I think it's quite important to start talking and introducing that as part of the training. But one of the things that I have seen also is that sometimes the undergraduates, okay, they are very clear on values and the way things are, but once they are introduced into the health system, that's when they started to deviate. And they started with questions like, I mean, because they have come to me, and just recently that I'm talking about corruption, like, do you think this is bad or good? Because everybody is doing it. So what I'm saying is that as part of the training, I think we need to talk about conflict of interest, but we need also to use some cases maybe to show them that which is the way things are is not the right way. So we should not allow them to deviate. So that's one thing that is quite important. The second question, I didn't get it very well. It had to do with? So you were worried about how much corruption there is. And
around insulin.
And how that will affect diseases like non-communicable diseases. I completely agree with you. That's what I was telling you, that corruption undermines any effort that we are doing. I can tell you, I mean, one of the things that happens, I mean, we bought medications for patients with diabetes, and we calculated as soon as I started as a minister because there was a stock out, and we calculated enough medications that will last at least for a year and a half. And in a matter of 2 months, there were no medications, okay? And what was happening, actually, we started an investigation. We will read it a little bit in the article, an investigation, and there was a system sucking medications outside. And of course, that means that these patients will need to, if they have money, will go out of the pocket and will go to these pharmacies that were selling the same medications that the ministry was supposed to give for free. And the ones that do not have the money will suffer from it. So definitely, corruption is affecting every single thing that we do in the public health level, but individually too.
And advice for investigative journalism.
Yeah, so that's a tough one. You know, one of the things that I was reading is the number of journalists that are dying because they are investigating in corruption. And I'm not kidding. I mean, I'm not kidding, okay? So it is a tough issue. However, I have to say that I'm very grateful for journalists that are able to bring these things openly, because that, for example, that's what helped us to find out all the things that were happening at the national insurance system. So I think it's like, keep looking, listen to the people, okay? Because people knows, but sometimes they get used. Maybe one of the things that we need is we need to talk with the people so they should realize what is normal and what is not normal. So paying additionally is not normal. Bribing is not normal. Being sent from the public to the private sector is not normal. And maybe bringing them, if there is a way of reporting these type of situations, giving them a space for the report. And maybe with that, you can help also and catalyze some changes. But it's hard.
Now, we've got plenty of time, so we can capture everybody, don't worry. Please, second row, and then Rory, and then gentleman on the edge, so to speak, of the
Thanks
aisle.
very much, Professor Patricia. It's a pleasure to see you after so many years. I was your student at Cayetano Heredia University. So I would like to ask you, from your perspective as a former Prime Minister, how corruption shape the public health agenda of a country as Peru?
That's a great question.
That's it.
Okay, Rory.
My name's Rory Collins, cardiovascular epidemiologist, and thank you for your lecture. Particularly enjoyed it as a fan of conspiracy theories. And you know, for example, you gave you described Transparency International, and which is funded by the tobacco industry, and one does wonder why. But I wanted to ask the question whether really corruption is more important or less important than incompetence in terms of global health. So, for example, overly precise estimates of the major determinants of global burden of disease. Claims, for example, that legumes and nuts are more important than saturated fat as a cause of cardiovascular disease, that smoking causes more deaths from cardiovascular disease globally than tobacco. When one looks at this claims, they're based on very poorly modeled assumptions. And isn't there a risk that incompetence rather than corruption may actually divert attention away from the things that really matter from global health, and that we should be focusing on getting the evidence right rather than putting too much emphasis on corruption rather than incompetence?
Very good question. Expect that from Rory. And gentlemen on the edge, and then the woman immediately behind him. We'll take those two more and then come back to you, Patty.
My name is Odi Orsaim. I'm a trustee of a global medical charity called Gafi, looking at fungal diseases. And my question is around kind of looking at ways of eradicating corruption or fighting corruption. It strikes me, especially with Chile as an example, the social cost is something that can be shifted probably kind of as easily as a political cost and the criminal cost. And your research that you talk about, would you consider it having it be open source, where the data becomes transparent as an open source data set, as collecting data, and for people to be able to look at how they can increase the social cost of corruption wherever they are, in whichever society they belong in, which will be very different across the globe?
Okay, and immediately behind you. Yeah.
Tina Bobanova from the London School of Hygiene and Tropical Medicine. It's a real pleasure to hear you talking about corruption and really highlighting the issues. And we recently published a commentary. We had a huge amount of responses, 14 responses, talking about maybe we need something like Me Too movement. But what I wanted to mention is currently we're doing work on absenteeism and informal payments, and funders like DFID, various other, we are starting to get money to do this work. So I think there is a change that we see in the political climate internationally. But one thing that you didn't mention, and I wanted to get your view, one thing that we find very interesting in terms of thinking of approaches, because we don't know anything that works right now, but thinking about political science approaches and analysis. So for example, in Bangladesh, absenteeism, there are data, they are published, you know, in many health posts who is there and who is not. But thinking about the sources of power and why actually there are certain actors who may benefit from enforcing the rules. And these are, for example, doctors from poor families who find it difficult to come into the system. They're actually, as you say, they're struggling themselves in these situations. So we were thinking that's an interesting analysis by our colleagues in SOAS, really trying to think of who are these actors who would benefit from enforcement, and that has been very promising. What do you think about that? And generally, power, how do we deal with power?
Okay. So let's start with your former student.
Yeah, I already forgot what she asked for.
Peru. What was it? What's been the effect? Yes, on the country.
Yeah, okay. So, I mean, all the questions are quite interesting, but I have to start by saying I'm not an expert in corruption, and I told you that. So what I'm sharing with you is a very personal frustration from a citizen, a global citizen that is seeing that this is going on, and I think one person cannot fight it alone, two people cannot fight it alone. This has to be a global fight, okay? So, yeah, you're right. Some of the, and that is something also that is quite interesting, how the health or the public health agenda in a country can be pushed because of corruption. And that's one thing that I mean, I worried and I kind of have seen, right? We were trying to push for, you know, as other countries. Peru is a country that is in this epidemiological transition. So we still have infectious diseases, but we also have non-communicable diseases. And one of the things that we wanted to push was the labeling of the processed food, okay? So we had a lot of push from the industry not to have it, okay? I guess it was because I'm a very stubborn person, and I had a lot of data, and I have a lot of push. So we were able, and now in Peru we have these octagons, okay, that are labeling the food. But I guess probably if somebody who was there was not that pushy and that committed as me, probably we wouldn't have that as part of the agenda, how to fight against NCDs. I fear that what you are saying happens, and happens with little things and with bigger things that sometimes are not that clear for the public, okay? How do you choose a specific medication that goes into the list of medications that the government has to buy, for example, that might not be the cheaper or the most important, but is the one that has a lot of push from industry? Those kind of things happen, and we cannot ignore them. So it's happening, unfortunately.
Incompetence.
Yeah. So, incompetence is an issue, definitely. So I don't think we have to ignore it, okay? But I don't think it should be one or the other, okay? In this case, I'm talking about corruption because I think that corruption is also, we do have the numbers, okay? 25% of the money is going into corruption, and we need to do something. So I propose you that you work on the area of incompetence, and you allowed me to do. I don't think it should be one or the other, to tell you the truth. I think we need to push to try to improve whatever we have that is wrong. And the bad part about corruption is that they are doing it in purpose, okay? When you are talking about incompetence, I hope that you are talking about errors, problems, incompetence by itself. So we need more evidence to go against it. If there is evidence if they are doing the wrong thing, so I would call that corruption probably, and we need to fight it.
The question about social cost and the importance of open science or open access to open source.
Yeah, I completely agree with you. I think we definitely need to go in that way in open science. And then there was another question that had to do with other models. I mean, what are the other kinds of things that we should work? Yes, I mean, we need to deal with the issues of power. So definitely, in most of our countries, power is one of the things that will really lead what is happening. But we need to understand how to fight it also. I mean, can communities in some way, one of the things that it's, how can we shift the power? One of the ways, and probably I'm going to bring you this example, it has to do with oncology and cervical cancer, for example, okay? So we have been talking about interventions that should be managed by individuals, what we call self-care interventions, okay? Or self-initiated interventions. So one of them is, for example, the self-sampling for HPV testing for cervical cancer. So one of the things that we are, and this is something that we are trying to push in Peru, okay? But one of the first things that happen is that professional societies are against it, okay? One is because, we are empowering women to do it by themselves, and we are taking the power from them, okay? And the second is that there is a conflict of interest. They feel that then they're going to be losing money because then women will not go to the clinic to have the sample taken or the pap smear taken, okay? So we need to think about power, and we need to think, how can we share the power with the citizens, and how can we shift the power so we have less monopoly as part of that equation? So that's another way in which we can fight corruption. I think there are so many things, and it will be so interesting to start seeing what are the kind of things that we can do.
Now we have 2 questions from Peru, I believe.
First one is, which should be the sanction for the public functionaries that commit corruption act? That's from Dr. David Estela. And the second one is, in a time where universal healthcare is under threat, how can universal healthcare address corruption in global health? And that's from Amy Powell.
Yeah, so number one is, should physicians be sanctioned? Yes, they should. I mean, definitely they should. If you ask me, how can they sanction it? I mean, I'm not the one to say how. But one of the things that I can tell you is that I think, at least in Peru, the whole system of investigation and sanctions in general needs to be reviewed. Needs to be reviewed. I guess one of the things that I admire from other countries is that people don't do things because they know that the sanctions happen and they are strong enough. So then people will think twice. Remember about, the equation, the criminal costs right? So those criminal costs are an important part of the equation. And then when they are talking about if universal health suffers, should we do something? I think we should be doing something as the global community. If we are all the countries are concerned about reaching universal health or reaching universal health care. So we need all to do something about corruption, definitely.
Let me come back to the audience. Afira, and here, and then the gentleman in the blue shirt. So we'll take those four. Afira first.
Afira?
Afira first. Just keep your hand up, Afira, so that's great.
Sorry. Thanks so much, Patty. That was absolutely incredible and gives us lots to think about. Just a couple of quick points. Sorry, my name. Yeah. Ophira Ginsberg. I'm an oncologist, and I'm here from New York University for London Global Cancer Week. And you'll be pleased to know at the Royal Society of Medicine event on Monday, corruption did come up a few times. There's a lot of, as you know, incentives where big money is involved, and in the cancer business, as it were, that's unfortunately one of the downfalls. So I got a question for you. Are there lessons from successful anti-corruption strategies outside of the health sector that we can think of as maybe applicable? Positive and negative, I guess, lessons learned either way.
Great question, thank you. The person who was just on the third row, keep your hand up so we can get the microphone to you. Thank you.
Hi, I'm Zoe Isaacs. I'm at LSHTM at LSE doing an MSc this year. Hi, Patty. Thank you for your words. So I'm wondering about the donor community, where it seems that there's some level of tolerance for some level of corruption in many places. So would you say that donors should adopt a zero tolerance policy for corruption? And would that mean that, you know, some areas in great need would be left without aid?
Okay, very good, thank you. Was it gentleman in the orange jumper? Just keep your hand up so we know where to go. Fantastic.
Martin Allaby, I work at our National Institute for Health and Care Excellence, where I spend about 20% of my time dealing with conflicts of interest from people who want to work with us. It's a question about outcomes in anti-corruption research and the challenge of measuring them. So I can see that some outcomes, like absenteeism in the public sector, might be relatively easy to measure. You can just go and look, has Dr. So-and-so turned up for work today? Other outcomes, like reduction of embezzlement of funds, much more difficult to measure. It might need an investigative journalist with a lot of courage, and they incur life-threatening risks gathering that sort of information. So interested in your thoughts about how we can collect the data on outcomes as we do that research.
Very good. And the gentleman in the blue shirt.
Thank you. My name is Justin Parkhurst. I'm at the London School of Economics and Political Science, the LSE. And it's more of a comment. First, I want to thank you very much for a very interesting and inspiring talk. And my comment was, if there's going to be a research agenda in global health, I would just encourage people working on that to really look to the political sciences. It kind of follows on from Dina's comment before. You mentioned you looked in PubMed, and in a year you only found about 100 some odd hits on corruption. I happened to look in Web of Science when you were saying that, which covers the social sciences, and you would have gotten 2,673 hits in the last year, with 824 in the title alone. So when the Wellcome Trust decides to fund this Lancet Commission on corruption in global health, I would just greatly encourage you to please reach out to some political and social sciences about it, and the LSE Global Health Initiative would be very happy to help make those links for you.
Fantastic.
Thank
okay,
you.
We're building partners by the question.
Yeah, that's great. That's
okay.
great.
So let's go to a first question first. Lessons from outside the health system.
Who was the person who asked?
Yeah.
Yes, okay. So I was looking at some examples, okay? But they are tough, I think, to follow. There are some examples from Vietnam in certain areas, but not in health. There are some examples in Singapore, which is also really tough. So, I mean, I guess most of the examples that I have seen had to do with real severe sanctions, and I'm not sure about all the outcomes, because what I was telling you is like it's difficult to measure out. I mean, going into your question, measure outcomes, and that's something that we need to start thinking. Maybe because it's health, we could start looking at some sentinel outcomes of the different actions instead of looking for every single one. So absenteeism, as you said, is one that is very easy, but I don't have the answer for that, okay? I have been looking at different, I mean, is having more reports of corruption a good outcome or a bad outcome, right? When you start something. People feel more comfortable coming to the center and telling you what is wrong. Is that a good outcome? So I think we need to look at several levels and understand much better what is going on and choose probably some of the areas, different areas. I mean, there are some areas that we know that there are, it's quite interesting, for example, what OECD did to try to measure some aspects related to corruption in construction. So what they did is they got a bunch of bridges and roads and different things that were done with how much they really cost, the real costs, and then without telling how much it really cost, they got some experts and asked them to cost how much it would have cost. And that's how they calculated, for example, the difference. And they found out that all these things that were done, and this was in developing countries, okay, were overpriced between 20 to 25%, for example. So it was quite interesting. So this issue about expert advice or expert counseling to see if it was overpriced or not. So there are so many things that we need to explore, but I think we need to, part of this coalition is to start thinking and what are the different issues that we should start measuring. I don't think it's that easy. I don't think anybody has resolved it.
Zero tolerance with donors?
Yeah, so your question is very interesting. You know, somebody was asking me also, and you haven't asked it, but I think it's quite important, why people don't talk about corruption, right? And so one of the issues is because sometimes the good people is afraid of talking about corruption because maybe it's not corruption, maybe it's an honest mistake, so, right? So sometimes it's a little bit difficult. The second reason is because people think that if we start talking about corruption, those fragile systems, at least with corruption, they are working, and they may not work if I say that there is, or I start attacking corruption, right? And then there are other fears, the fear of being attacked or the dark, or going to the dark side, etc. So I really think that there should be zero tolerance from the funders to corruption, okay? But that zero tolerance does not necessarily mean that you are not going to fund them. I think there should be a commitment in both sides, and there should be accountability, and clear accountability for that. Sometimes, unfortunately, the kind of indicators that are asked or they are by funders, and I understand it's complex, right? It's just to reach at a center number or to reach it. I mean, I remember in our case, we were supposed to, or the country was supposed to distribute 1.5 million condoms, but because the condoms came very late, we're supposed to distribute 1.5 million condoms in 2 weeks. So people could find condoms even in the soup, but that didn't mean that was a good intervention. And the problem was that the funder has this timeline that you have to follow. So I think we have to have definitely this zero tolerance, and we have to work with the countries, okay, on how to do it and have better accountability. And I mean, and this fear that things may not work and they will keep going down, well, I guess we need to work also on how to strengthen the system and not tolerate what is going on. Otherwise, I mean, we will never allow those countries to really graduate from those funds. And that's not what we want, right?
And Justin made a good plea for political science and social
science. Yeah, I agree with you. I agree with you. Only one caveat. I have read several of the articles. The issues is that still we don't have good models that work. Okay.
Okay. Any further questions from Peru? Okay, that's good. Good. At the back, you've been very quiet. So 2 people sitting side by side, and then somebody
3,
over there.
4.
And we've got to be super quick now because we've got no time. And Anne's looking at me.
Hi there, I'm Rob.
So we're going to have very quick points.
Yeah, Rob, pharmacist at St George's. So my question is, it's looking at this accountability model. It looks like you had a lot of issues in your lecture with solving corruption in your country with political power and even regulatory power. I'm just wondering, it's a multifactorial problem, affects lots of different people, lots of positions. How do you envisage a strategy to have a multi-componental system for accountability? What ideas do you have?
Okay, just the person next to you, and then we're going to have to stop.
Yeah. I'm Marcela Contreras. I was director of the National Blood Service. I met you in Peru when you were a minister. But I'd like to ask you, if the welcome gave you...
You mean when?
10 million pounds. When the welcome gives you 10 million pounds, what research projects will you have? And the second thing is...
No, because we've got... I'm going to get into super big trouble. 30 seconds each.
Yeah, there is one more, no?
No, we can just take two.
Yeah, well, you're asking me to solve the problems that nobody has solved yet. I don't think that's fair. I don't think that's fair. And what I can tell you is that's why, and I don't think I have the solutions. I'm bringing you the problem. I'm trying to... What I think we need is a coalition of people so we can work all together. I mean, there's some experiences here, some experiences there. I think we need to think different ways of better accountability, fighting the power, criminalization, all those things. I don't have any answer.
And that's a good place. That's a good place. That's a good place for me to hand over to Anne Johnson.
Thank you.
Thank you to all of you. Thanks to Peru. Thanks.
Finish off now by thanking Patty for what has been really an inspirational lecture. I absolutely agree with Richard's opening comment that this was a brave lecture. You're far too modest. You said you weren't brave, you said you were stubborn and pushy. I beg to disagree. Whatever it is that's in you, it served you very well in a wonderful career where you've been brave in your research, you've been brave as a minister, and you've been terrific today in really raising for us an issue which I absolutely agree with you is an ignored pandemic. And I also, as an infectious disease epidemiologist, agree with your analysis about prevention, control, and elimination. And I was really shocked by the lack of data, actually. I think it's surprising. I realise you haven't searched every database, and you might have been a little biased. But nevertheless, we really need the data that you've described out there. We need a much better social understanding of the drivers. And it's clearly, to me, that there's a whole bunch of actions that we could think about in this space. And we've heard what they are. A Lancet commission. I'm not going to comment on the funder. But clearly, Richard has the power to suggest that we might think about that. And then I think really working with a coalition of independent researchers seems to me hugely important, and those researchers, we need to think about that commitment to zero tolerance. But you, Patty, have given us a call to action, and that call to action is to eliminate corruption from global health, and in doing so to build a global movement to do so. And you're absolutely right, nobody can do this alone. It is too dangerous a thing to be doing alone, but it is something which, as a global community, we clearly have to address. And I hope that many of you in the room will respond to that challenge and bring to what we've heard today, which is a hugely difficult topic, your ideas, your energy, and share with Patty in her call to action. Here we are, I'm speaking on behalf of the Academy of Medical Sciences, and there are many academies around the world, and we participate, for example, with the international academies and the IAP, which often needs to address big questions in science, which sometimes are the really difficult questions. And together, I think we can be more effective when we build a very clear framework for going forward. So I thank you personally from the bottom of my heart for travelling all this way. I've loved working with you over the years. Terrific to see you give us this wonderful lecture. And before we all give you another rousing round of applause, let me also thank Richard for his tremendous collaboration in holding this lecture. We discuss every year who should give this lecture, and there was, I can tell you, huge support for you to do so. Absolutely unanimous. We're delighted that you're here. Don't forget to watch the video again. Don't forget Patty's wonderful manuscript. If we're really lucky, they might be available when we go out, but I'm not quite sure. If not, they're definitely available online, and they're open access, Richard, is that right?
Online, open access.
Online, open access.
Yeah.
Please complete our evaluation form, because how do we move forward without getting your views and feeding back to us? And last but not least, of course, the canapes await you and the drinks outside. Please continue your conversations. Please think about how you might respond. And we look forward, I think, to continuing this conversation and hearing from you all. Thank you all. I must thank Liz and Sarah for the wonderful organisation at the Academy, to the British Library for hosting us here, and most of all to our wonderful speaker for a really tremendous evening. Thank you, Patricia.
Thank you so much. Oh, thank you. Thank you for the invitation.